Perfect. So today we have Jason with us, and Jason is a national sales manager who is going to cover some Humana Medicare with us to go over some product overview, the supplemental benefits and tools, and just making the Humana difference, what it's about, and why Humana would be a great opportunity and option for you as sales agents to be able to use to present to your clients. So with that being said, welcome, Jason. Thank you.
Awesome. Thank you. Just a quick intro for myself. As you said, Jason Brining with Humana. I've been there for 15 years now, the last 8 or so in the Medicare area. And so just essentially, like you said, what we're going to go over, we'll hit the different supplemental benefits, which makes, kind of Humana the above and beyond, I always say, as far as what we may already have on the product. The other positives, we're going to go over some of the national scope of product stuff. So we're going to have a lot of positives from a Humana product perspective this year. So just something to be aware of. What we will do is go through everything that's going to be nationwide. So every time you always want to look at the summary of benefits, but we'll kind of give a much more national scope. So just going into the piece of it here, you see the product overview, the supplemental benefits, and then we'll also have what we call our clinical initiative, or often referred to as Humana at Home. How I refer to that is that's kind of Humana's investment into its members and ultimately making a more productive and healthier member in the long run. So first, just before we go into the product piece, I always use this a little bit in that regards, the fact that I live in Madison, Wisconsin currently, and Humana, well, people typically know a healthcare company. They don't know the name near as well. I spent a couple of years in Orlando, Florida, and obviously there it's a household name. You can't get through a day of AEP without seeing a commercial. So I use this just to kind of so people have a good understanding in case in your area or where you're selling, if Humana isn't well known by them. Midway in the PowerPoint or the slide there, you see 30 years of Medicare plan experience. So it, also on the bottom 2 bullets, you'll see there over 3 million Medicare Advantage members and over 5 million PDP members. So just gives you an idea as far as the overall outlook of the size of Humana. Again, not something you need to use for every member, but if it's somebody that doesn't know a lot about Humana or the size of it, to understand that it's a strong company. Here, just going into the product updates then. So again, as I said, make sure that you're looking at the summary of benefits every time. However, if you look at this piece of it, I think when you look at this from a nationwide perspective, you'll see there's a lot of positive benefits on the slide. So of course, things coming out with lower PCP copays. A couple of them that I'll point out here that I think are very positive from a national perspective. So you'll see here the over-the-counter benefit amount. So we'll go over exactly what over-the-counter is in case you guys haven't necessarily worked with that benefit in the past. However, the plug for this year is that we've had this for about 3 or 4 years now, and over the last 2 years, you've seen a lot of the amount decreasing from that. And so you're going to see it's going to be increasing this year in a lot of markets and areas where we may not have had it in the past. You'll see us adding that also. And so in general, how I've been kind of pointing it out to agents from looking at the product perspective, it's just the fact that, over the last 2 years, we've been kind of under what I call the Aetna umbrella, where we had sort of the potential for acquisition. And so we stayed fairly stagnant during that time. While we did grow, it really wasn't the kind of growth that we were used to 3 or 4 years ago. And so the big positive is, obviously, without that acquisition happening, I think what you're going to see this year going into 2018, Humana has put a lot more money into the plans, and Humana is looking to get back towards the normal membership growth that we got sort of accustomed to 3, 4, and 5 years ago. And so if you've been working with Humana products that long, I think you'll be excited to know that we're getting back to that area. Also, you see there the expansion of dual SNP markets. So we'll take a look at a slide that We'll have a large expansion there, just a large expansion in general this year. Again, we'll have some slides on those also. Lowered MOOPs, lowered copays, Part B give back areas. That's going to be another big one. We'll have a specific slide on that. However, in the past, it's typically just been in the state of Florida. You're going to see us have about 10 to 12 states this year with the Part B give back area. And then at the bottom of this, you'll see here also the last bullet. Many areas are going to have no referrals for HMO. So that will not be the case in Florida. They'll have referrals for HMO. And then there's going to be other pockets throughout the nation. However, the larger majority of the nation you're going to see is not going to need referrals for the HMO. So that's going to be another big positive. Again, make sure that you're looking at the summary of benefits. However, a lot of times that gatekeeper is sort of the negative of the HMO. And so I think you're going to see that being a positive look in the products again this year also. So going into the Part B give back area. So again, the two things that I think are probably the top from a plan outlook of changes, probably the Part B give backs and the over-the-counter benefit increases. So here, the Part B give back areas, you can see here on the right-hand side, towards the lower part of it is where Florida. You're going to see some expansion there. However, the largest amount of give backs is typically in Florida. So you see those amounts there, $75 to $94 for their give back plans, which is a easy route of selling. Also, obviously a great benefit. However, all of these other states being added gives from a national perspective, gives a lot more reasons and areas to be able to sell that Part B give back. And so typically you see there $40 to $50 per month. And how the Part B give back works is ultimately Humana is paying that amount. So if you see there $40 or $50, whatever the amount may be, Humana is going to pay that amount per month to Social Security, and that much amount will be taken off of that member's Part B premium. So they're going to be saving that directly from their premium paying to Part B. So I can't, push that benefit enough of how great it is. Members that get on that Part B give back get used to that, obviously, and it's something that you're gonna find high retention with those members also. So again, just make sure that you notice the large expansion of it. A couple of things I always point out. So questions that come up from this is, what if they're not paying any Part B premium because they're getting something, they're getting that paid already by Medicaid? That this would not be a benefit for that member if they're not paying part of their Part B premium. We obviously, we're not sending a check directly to the member here. It's just paying that from Social Security. And so that the reason that I say it may still be worthwhile telling that member is if they start making more money during the year and suddenly lose that assistance for their Part B premium, that might become a benefit for them yet. So the other piece that I always kind of add on in here is that a lot of times with the Social Security piece of it, it may take up to 90 days to have that payment take effect. We will, if it's late in that payment taking effect, meaning it takes 2 or 3 months for that to happen, we'll pay that first time of payment. We'll actually pay back retroactively then to cover those months that they missed. And then from there on, it'll pay that whatever the amount is per month that you see in the summary of benefits. It'll pay that amount. Humana will pay that amount per month towards their Part B premium. So again, I can't stress this one enough. This is going to be a great selling point for us throughout 2018. Going on to the next slide here. So here you'll see some of our top states. We just ranked them in order. Obviously, this will most likely change as we go into 2018. I really kind of point out on the right-hand side a lot of times the HMO, just so that you are aware. HMO typically is going to be about 50% of our sales. The other piece that I point out here, the LPPO and the RPPO, so the local PPO and the regional PPO, that is going to be something where last year you would have seen those two numbers would have been almost identical. Now you see the local PPO has a much higher percentage. you'll continue to see that local PPO increase in percentage. We'll take a look at a slide specifically in regards to those two of why that's happening, but just to kind of take note of that difference here. Also, last year, if you were working with Humana products, you would have seen the same slide here. Would have had 2 to 3 counties of HMO counties of new expansion areas or new product expansion. This year, you can see there 100, and if you follow it way to the right-hand side of that slide, where it says HMO on the top, 127 new counties for HMO and over 80 for LPPO expansion. So over 200 counties of new expansion for both LPPO and HMO. Again, I think what you're seeing there is you're really seeing Humana kind of getting back to where they were 3 to 4 years ago in that kind of growth mode. Expansion gives you more areas, obviously, to be selling. This just takes a look at the HMO. On the left-hand side, you'll see new markets, and then on the right-hand side, you'll see expansion markets. So it really is the expansion markets essentially are going to be areas typically where we already have a product that does well, and so we're looking to essentially add on counties in those areas. And then here you'll see the same for LPPO, the expansion on the left-hand side, again, new markets, and on the right-hand side, the expansion markets. Going into the LPPO versus RPPO, or local versus regional PPO. So regional PPO, why the local typically works better for the carrier is the regional PPO, CMS actually designates the plan service area. So on a regional, I'll use the state of Georgia. On a regional PPO, the area that they would deem to be that regional PPO would be the full state of Georgia. In some states, if they're smaller states, you may see multiple states. However, on a local PPO, the carrier actually designates that plan service area. So for Humana, I'm just using this as kind of an example. However, for Humana, the Atlanta area may be a very strong network. And so we may say, okay, yeah, we have great negotiated network discounts there, great doctor deals. And so in that area, we may have a really strong network. However, the rest of the state of Georgia, we may not. And so when you look at the full state, a lot of times you have to give up some of that potential where you may have a network benefit. And so when we're able to focus in on the local PPO where we have the strongest negotiated deals, that allows us to essentially pass more of that on to the consumer. So a lot of times that's why you'll see with our local PPOs, we'll either have lower premium or we'll have stronger benefits there, possibly more of the supplemental benefits that we're going to look through, things of that nature. And I think that's probably what you'll continue to see, not just in Humana, but probably across several carriers. But that's going to be something you're going to continue to see happen for Humana as we go year to year, continue to make that local PPO stronger than typically than the regional PPO. Looking under here, you can see the dual SNP. So again, this isn't a big one for Humana during the AEP timing, obviously, or for you guys selling. However, during ROI or the rest of the year, this is always a big one. And so here you can see, if you can notice the color difference on there of the states that are in red. Any state in red is actually where we're going to be expanding. So either that could be a brand new state for us, or it's going to be a state that's adding counties to the dual eligible SNP. So there you can see just about 2/3 of them we're going to be having a large expansion. Again, stressing kind of back to the 3 or 4 years ago where we have a lot of growth moving forward. And then the chronic SNPs there, you probably saw on the other slide, it's about 2% of our total sales. However, we'll be adding 1 county to chronic SNPs. So you can see there the other states that will still have chronic SNP plans in. And then our PDP, I always push the fact that, especially if you're a new agent or if you're a veteran agent to Humana, you probably know already, obviously, that you see their Walmart PDP plan is just about 90% of our plans. So that's pretty well the norm. Just so that you're aware, that is always going to be a big chunk of our sales, especially if you're new. Overall, you'll see here the Walmart plan is going to be in the middle. Not many changes. However, I always point this one out so that everybody is aware. If you look at the Walmart plan in the middle in the white, that deductible area only applies to tiers 3, 4, and 5. So tiers 1 and 2 do not apply to that deductible. So just a nice selling point for it. We don't have the pricing isn't been given out yet on our deck here. It is going to be something where typically with the Walmart branding, them being the low price leader, typically you're going to find our Walmart plan to be one of the lower across the nation each year. Medicare supplement, so in general, our Medicare Advantage and our PDP is definitely our, what I'd say is the bread and butter at Humana. That's a big chunk. You do see we had about 3 million and 5 million members. For MedSup, we have about 250 to 300,000 members, so a much smaller base. However, we are going to be having some rate decreases in the fourth quarter of this year and the first quarter of next year in some of our MedSup. And they'll be adding on when they do those rate changes in those states. They typically will also be adding a Plan G. So I just kind of point out to watch for that. It's going to be something you're going to see some of our MedSup states becoming more competitive because of that. Essentially, we're just waiting on state approvals, and so I know more info will be kind of sent out as we have more of those decreases start to happen here shortly too. Just going into the supplemental benefits. So supplemental benefits, these are really, again, where I always push these mainly, while they're great during the rest of the year, or Roy also, prior to AP, this is why we really go through a lot of pushing this training also, is because these are the extra little pieces that Humana has on the plan. And obviously, Humana is paying a charge to have these different supplemental benefits on each plan. So I always let agents know if you're not telling the members about these extra benefits, you're really doing yourself and your member a disservice by not letting them know about all the things they may have on the plan. And so I also push the fact that, obviously during AP, you could sell a plan on October 15th to someone. Somebody could come around on October 17th, and another carrier, another call center agent, something of that nature, could sell them a plan, and you could ultimately lose that sale. And so I always push to add in some of these supplemental benefits because it might be that extra piece that helps save your sale from another agent taking over that sale or another carrier. So all the supplemental benefits that we're going to go through here in this section, all of these are supplemental benefits, not value adds, so you can discuss these during the prior to sale. You can discuss all of these supplemental benefits. The first one here, Welldyne, I think this is a great one. It's on over 90% of our plans, so obviously highly out there on a majority of them. The other great thing, it's served over 1.5 million meals, so widely used. But what I love about it, it's very simplistic. So if you can say it's very simple to them, that means if another agent called them or another carrier, they could simplistically explain it to that other person and why they want to keep the Humana plan because they have Welldyne. So the simplicity of it is if they go into the hospital overnight, they're going to be able to have 10 meals sent out to them for free. And so, again, very simple to be able to explain them. A few other pointers on there. If they go in for four, they'll be limited to 4 times per year that they'll be able to use that benefit on a regular MA plan, so up to 40 meals. And if they have a chronic plan, they're going to be limited to 2 times per year, so 20 meals. A couple of extra pointers just to kind of pick up on in this regard. The Welldyne piece of it is a great one where, think about it from their perspective. They've just been in the hospital. They're probably not feeling well, and so it is something where rather than having to go grocery shopping, they're having the meals sent to them. Also, obviously, that you and I driving every day, that may not be something that they're able to do. They may need assistance with driving, or they may not have access to a vehicle. So again, just really a simplicity being delivered directly to them also. Silver sneakers. So this is typically one of our largest, I would say, a great from a brand recognition. It's not only for Humana. However, the silver sneakers brand recognition seems to do very, very well with seniors. So often if you have somebody calling into you saying, well, I want that Humana plan, it's because they're saying, hey, I want to get Humana because I know it has silver sneakers with it, or they know a friend that is Humana plan with silver sneakers. And so this does give them a route where they can go. You can see there, you can actually search for locations on there. A lot of the locations you're going to see it may be a local YMCA, something of that. And it is going to be something where they can go in and use that gym. Some of them will have classes for the members. The other great part about this one this year is that there's going to be another large national carrier that may not be offering silver sneakers in all states. And so I know we're going to be typically going to be having, probably a little bit more disruption this year than we may have in the past, because people, if they realize they're not going to have silver sneakers, there's going to be more likelihood that they're calling back in and saying, I want to look for a plan that does have silver sneakers, obviously, especially if they're using that extra benefit. Go 365, so this was called Humana Vitality in the past. This is a great one. Again, the more the difficulty is explaining it to the member, and so we'll explain it more in depth. However, I like to try and keep it very simple for them, letting them know that essentially if this is on that summary of benefits for them and they have it on their plan, that they can sign up for it. They're going to get a mailer out to them, and they can actually send that back in. It's going to have some health questions on there, some exercise questions, things of that, and they're going to be able to send that back in and essentially sign up for it. After that, they're going to be able to do several different routes to be able to earn points, and then once they earn those points, they can actually turn them into Target or Amazon gift cards or movie tickets. So a little bit more in depth as far as how they earn points. So they can get a pedometer, they can set that up and be able to just get points for just making steps. They can also, if they go in for their annual physical, they get their blood pressure done. They get other things done like cholesterol check, height, weight, things like that. They get points for all of that. If they do going to silver sneakers or in a dentist visit, eye doctor visit, getting points for all those different routes. And so very simplistic. Just I always explain it as doing points, doing the same things that they're currently doing. And then ultimately they can turn those points in. There's actually a whole Go 365 mall, and so there's hundreds of different items on there, apparel, things of that nature. I really limit it. We have this on our own group plan internally at Humana. I essentially do all the things I'm just normally doing already, but then I turn those points into Target gift cards. And so you're already going there, already spending money. It's easy to get gift cards and be able to sell it that route. There are, like I said, other apparel items, equipment items, all sorts of other items also if they want to. But sometimes it makes it just more simplistic to let them know there's Target gift cards, Amazon gift cards, or movie tickets too. Over-the-counter benefits. So this is the one where I was talking about. You're going to see a big increase across the board. So either the dollar amounts often being increased, or there might be areas that we didn't have a benefit in the past, but they'll be added. So what it is it's going to be either a monthly or a quarterly. Typically, you're going to see a monthly amount between $10 and $50, depending on what the summary of benefits says for that specific plan. It is a use it or lose it benefit. So if you don't use it that month, you do lose it. It does not roll over. So keep that in mind for them. Ultimately, what happens is if they have, let's use a $30 a month, we'll actually send them out a catalog that's going to be 4 or 5 pages. It has listed all the different items they can get along with the price, and they select which items they want for that, whatever dollar amount that they have in their area. Some of the different items, they are all going to come from Humana Pharmacy, so we'll look at a little bit more on the next slide. What is Humana Pharmacy? However, all these items are going to get them using Humana Pharmacy, and they're going to get the items from there. You can see there the second bullet, a little listing of the items. The vitamins is always a big one. A lot of times we have members that say, well, I'm already getting a vitamin, some sort of supplement that now they start using Humana Pharmacy for and getting that for free. Other items on there, you see Band-Aids, cold meds, cough meds, allergy meds, first aid supplies, all sorts of items on there. I always say that with, essentially looking at spending this free money, it is really easy for them. It's something that's a real positive, an extra benefit that they're getting to the plan that they may not be getting with another plan. So the other one piece that I always add in is a question that we get a lot of times is from members is if they went to purchase something, can they get this to reimburse them? No, that's not how it works. They do have to use it at Humana Pharmacy, the mail order pharmacy. So make sure that they understand it's not something they're getting reimbursed. They do have to use the paper catalog that's sent out to them, or they can go online and fill it out also. So the next slide here, you see Humana Pharmacy. So what is this? It's actually a Humana-owned mail order pharmacy. In the past, you might have heard it also referred to as Right Source. So it is like I said, Humana-owned. A few of the nice pieces on there that sometimes people don't realize. On the far left, you'll see there $0 copay if they're doing most of the generic meds. If they're doing a 90-day supply, they'll be mailed out to them in a $0 copay. In the middle, you'll see there in the middle top bullet or sort of column on there, the easy to use. Humana Pharmacy will actually call out to the member when they need to either renew their prescription or refill it. So we do want them to continue doing that and making sure they're filling it. On the way right-hand side, also another one of the sort of pushbacks against the mail order pharmacy is the fact that them being able to, is it going to be accurate from that, getting it through the mail? And so it is actually, we had a bullet last year that talked about Humana Pharmacy being slightly more accurate than your sort of in-person pharmacies. So you can see there on the right-hand side, two pharmacists will two pharmacists will check every new prescription. So a really good one there just for the fact of sort of how accurate it is also. MD Live, this is a good one where we test piloted last year. We have this on our own internal plan. So it's a real positive that you'll see it expanding. However, it won't be on a majority of plans. So the negative is here you won't see it probably quite as often as it typically will test pilot something on plans and then slowly expand it to other areas. It does have a really, the nice piece about what it is that you essentially download an application and you use it almost like FaceTime to be able to talk to a doctor. So the negative, of course, about that is that they do have to have a smartphone where they can download the application. Essentially, you just click on that application, and you can click if you want to do call next available doctor. When I did this, it took about 3 minutes to get a doctor available. It is an actual doctor, so they can do things like writing prescriptions. Also, if they don't want to do next available doctor, if they want to have a certain time for an appointment, they can look through different doctor bios, read up if they want to see a specific or talk to a specific doctor, and then also like I said, they can make the appointment with that specific doctor and have a certain time. It does really help the fact that if they're vacationing somewhere, the ease of it, just for them to be able to not have to go and look at the checking about the network and being able to call to the MD Live. It is a third party. There's typically, depending on their area, either a $10 or $20 office visit copay for using the MD Live. So make sure you look in the summary of benefits. It'll be listed next to the MD Live what the copay will be for it. Humana in your community, you'll hear us often refer to these as guidance centers, and so these are going to be essentially a branded area it's going to be a Humana branded storefront hub So just to, again, with these, typically from a call center approach, it is difficult to know are they in that specific area. So a lot of times they'll give you kind of the outlook of the areas that they're in. Typically where we have our larger amounts of membership is where you might see those guidance centers. A lot of times too, from our approach, we just want to make sure that people are also aware. So if somebody calls you and says, hey, I want to get that plan, I have a friend that goes to the guidance center, I want to get that plan. Any Humana member can actually go to the guidance center. So this isn't something you have to look at in their summary of benefits. This is just automatically, if they have the plan, they can use the guidance center. So the guidance centers, they'll do things that are going to be socially active. So you might see them do different things. Yoga, I think, is mentioned in there. Even possibly just walking, different exercise type of things, and then also you might see that they'll have a cooking class, things of that. So different pieces. You'll see different guidance centers doing different things, but ultimately trying to get them more socially active with other people in their age. The nurse advice line, this is the other one I like, especially with Welldyne. If you're coming near getting time for the enrollment and you say, okay, let me just take a minute or 2 minutes and explain a couple of supplemental benefits. Welldyne's a quick one. This nurse advice line is also on over 90% of the plans. So again, it has a large amount of plans that it's going to be on, but also very simplistic. Just letting them know that you're going to have a 24-hour nurse advice line. This is 24 hours a day, actual registered nurses. So they a lot of times people are calling in. It might be the same info that they might be able to get on WebMD. However, a lot of times people don't necessarily have access to the internet. Also, a lot of times we find that these people calling in, they're really calling in to get peace of mind. They talk to an actual nurse. They found out, okay, yeah, this is what I could be doing possibly better also for whatever health condition that they're currently working with. So next we're going to go into the clinical area. And that clinical is what I always call Humana's investment into its own members. And so you'll see at different pieces of the clinical, we'll have a short video of one. We'll have a short video of somebody that actually, an actual nurse that goes out to the member's house, goes with them to the doctor's office. We also have clinical care may also be a nurse that's doing that over the phone. So they might not go see the person in person, but they might call out to them and go over different pieces of the health with them. And so a lot of times, we'll kind of, as we look at here, you'll hear us refer to it as Humana at home. And ultimately why that is because it's Humana trying to meet the member where they want to be met. And that's ultimately typically at the home. And so a lot of times, agents will say, well, how do you get to be part of the Humana at home care or part of the clinical care programs? And so ultimately, it comes down to their health. This isn't anything you have to look at in the summary of benefits. This is ultimately whatever their health conditions are going to be what gets them to be part of the Humana at home care. And so there's two different routes of being able to get into the program. If they have a claim, a specific claim, we may target us to call back out to them and say, hey, would you be interested in having a nurse come out to your home? And they may go through either discussion or more outlook of their health status. However, the other route is, while you can't talk about the health information up front to them prior to enrollment, as soon as they enroll, we actually reach out to them. You can see there on the right-hand side of the slide, over 90% of members are contacted, and over 72% of those members complete what's called an HRA or a health risk assessment. So ultimately, they're going through that health information with someone from Humana over the phone, and then they'll look at it once they have that health info and say, okay, does this make sense for them to have somebody, a nurse come out to their home if they have more health issues, if they maybe have less health issues, but it might make sense for them to have a nurse contact them over the phone, anything of that nature. And so why I point this out to reps, for one, so that you understand how they get into these Humana at home care and why, ultimately you're going to see, if you ever have a member that goes through that, that's going to be a member typically you keep for life because they look at Humana going above and beyond what any other carrier would be doing in that circumstance. Also, I tell everybody this so that you know, going into the enrollment, you can let them know, we're going to finish your enrollment today. However, Humana will be reaching out to you also to go over health questions with you. And so they don't have to go through the health questionnaire if they don't want to, but obviously it's in their best interest to go through that. Also, if they didn't want somebody to come out to their home, they just want to do it over the phone, they can do that also. But again, the Humana at Home Care Manager will discuss sort of what's best for them potentially in looking at that. So ultimately, the integrated care delivery that you can see on the upper left on there, the three main pieces that come from it: slowing disease progression. So they may have something that we can't necessarily cure. However, we might be able to slow it or just essentially help out their the better lifestyle. Also, you see there the improving health, which ultimately comes to lowering the healthcare costs. So obviously, the lowering the healthcare cost is a big positive for both us and them. And then a lot of times reps will say, well, how, I see what Humana has, clinical care. How can that ever make sense for Humana to pay that upfront money to have a nurse come out to their home, go through that kind of care with them? And so I always like this slide. On the left-hand side is the membership. On the top of that, the top two tiers of the pyramid make up 25% of our members. And if you follow that 25% of members to the right-hand side, that 25% of members makes up 80% of our healthcare costs. And so that just gives you an idea that there's a lot that can be saved with helping out that top 25% of members. And so on the healthcare cost, if you follow it to the far right, you can see there the members that have the most health conditions. Those might be the members that have home visits, things of that nature. And then also, as you follow it down from there, people that have more, sort of less health issues than needing a nurse come to their home, but they might have still considerable health issues. They may have somebody reach out to them over the phone on a more regular basis. And then, of course, ultimately, if they're more healthy, they might just have a call that happens quarterly from the Humana at Home Care Managers. And then the big positive, so I called it kind of that investment, and because that's because about 10 years ago or so, Humana sort of started this as a pilot to see, okay, does it make sense investing in those members? Does it, and ultimately what we found is obviously there's a lot of positives. One of them on the left, you can see there an 87% engagement rate. So this is one of those where typically we have a very high retention rate in the members that are part of the Humana at Home members. Also the improved outcomes. So you see there 44% reduction in hospital admissions. So of course that's obviously a really big positive for both us and the members as far as a benefit dollar amount savings. And so ultimately why we call it Humana at Home is because at the far right hand side of the slide there you see over 1 million more days at home. And so that's why we started to reference it as Humana at Home. Again, that's where the members want to be. And so that might ultimately just be a member that didn't have to go into the emergency room or possibly even just a doctor office visit, just spending more days at home ultimately. So here we're going to have a short video. So just to kind of watch closely on there. If you can't hear it well, we can send out the link after. But I think typically groups have been able to hear it fairly well. I just point out the fact that you're going to see the Humana Care Manager is going to be coming out to their home. She goes with the doctor's office, and we'll talk about a few of the other benefits that you see in there also. But one point that I always go to too, you'll see that she's really teaching him how to be more productive. So he ultimately, helping him make sure he's taking his medicines. One of the things we also hear all the time is that they have expired medications. So you'll hear her talk about that piece of it also.
It happened about 13 years ago or so. I had to have serious heart surgery. I had just got home recuperating slowly, and my wife passed away. And it was like a double whammy. We had been very preoccupied with music and had given many recitals, and I thought we were on the way to just playing professionally, but when my wife died, it just pulled the rug out from underneath me. A few years after that, I really became aware of the services that Humana had to offer, and they were just exactly what I needed at the time.
I'm Don's daughter. I'm his only child. I moved away, and it's definitely a challenge when you know someone is aging and they live far away from you. I think my mother had done a lot of the organizing, and my mother just wasn't able to keep up with that. This is really where they both lived for the majority of their lives, and you want them to be happy where they are. But again, as health situations shift, each one of those shifts is a challenge.
The very first time when I walked into Donna's home, look at his environment, people were used to everyone was fun. I mean, really fun. This is becoming gradually unusual. His medication management, years of expired medication. No actors were in home. I kind of lived up to what I had for myself. It's amazing how just having a life becomes stabilizing thing on your mind. I'm Gustavo Day. I am in Terry. I'm taking care of John and Connie. He has got foot wrong. I can hardly see. I'm taking Dr. medication. He's 90 years. For a see that I think that you will. I go to America, and when you look at the environment, you find out that some of them are really coming back to the hospital for just trivial things. No problem. They don't understand the instructions they've been given.
You need someone there. You need someone that can come into the home where they live and help kind of put those people together. You know, since we had the care manager step in, I just see this night and day difference. I think it's amazing. I was very fortunate to have met her when I needed somebody like Agnes. She's just capable of managing everything, and she convinced me that I could do it. It's very difficult to put those things in the words. She worked with them. She said, anything here, basically, and then let's check your blood pressure again and look at what's done. So she helped my father in a very tangible way. For me, I can talk to my daughter, son, where he's not. You are kind of giving me my back. Agnes has no strength of herself. She can answer questions. And of course, she laughs at my bad. She's made a big change in my life. Everything I can to each other. Now, as your son, I'm doing for you.
So as you can see from the video on there, that's one of those, where I think a lot of times you can see kind of obviously the difference that they're making, having somebody come out to their home. Also, she talked about just organizing, the home having clutter and where it might be dangerous for him to fall, different things like that. And so again, too, where you saw the pill bottles where she's just making him kind of getting a routine of putting him into the pill box every week and being able to make sure he keeps up with his meds. Also going to the doctor, that's always a big one, because a lot of times they'll look at it and they'll say, well, they went into the doctor or the hospital. Could we have prevented that? Is there a reason that they had to go in? And so a lot of times when they go into the doctor the first time, they may get 5 or 6 different items that the doctor tells them about, and they may only remember 1 or 2 and would have to go back in to sort of get a re-explanation of it. And so with them going in and taking notes at the office visit, they're able to help them out and make sure that they don't, continue to run into that item. So just kind of moving forward here, you'll see the compliance piece of it. So in general, there's 3 top categories of complaints. You'll see there the presentation and benefits, enrollment, eligibility, and provider. And this next one just really drills them down into those 3 more often. Provider participation, a couple of them that I always point out, just make sure that you are looking up their providers. And then, of course, the making sure they understand the difference of PPO versus HMO. Presentation and benefits. So typically it seems the agents do a pretty good job going through the summary of benefits. However, make sure that you're focused when you're giving them the medical copay or prescription copay. We hear a lot of those from recorded calls that are giving the incorrect copays, and I don't think it's on purpose. It's just a matter of that quoting a lot of different people, different plans, different areas. So just make sure that you're focused on when you're giving those, especially. Enrollment and eligibility, this I always point out, make sure that they understand that if it's a Medicare Advantage versus a Med Sup, we see a lot of confusion for that piece. So make sure that they always understand the difference of it. And then the last slide that we have here, the value-added services versus the supplemental benefits. So value-added services are something that this is a change that CMS made a few years ago. But value-added services are not guaranteed in the plan for the year. So a good example, we have Weight Watchers where we have a discount as one of our value-added services. They could come to Humana and say at any point you're not going to be able to get a discount with Weight Watchers anymore. And so CMS essentially didn't want you selling plans that may not have that guaranteed benefit. The big takeaway from this slide is that everything that we discussed today is a supplemental benefit, so you can talk about it prior to sale. And what that means is that it's actually written in. We give it to CMS when we submit our plans. It's actually written in there, and so it's guaranteed for the full year. It's locked in. So just make sure that you understand everything that we went through today is a supplemental benefit and something that you can talk to prior to sale. And with that, I'll open it up if there's questions. We'll go through if it's anything that we went through today or just any questions in general, we'll open it up.
Awesome, perfect. Thank you so much. You did a great job, great presentation. You guys can feel free to go ahead, send any chats into the little chat box there. If you have any questions for Jason, I'm sure he'll be able to help you out and go over some of the information if needed. I don't see any questions. Any questions coming through at all? Like I said, there should be a little pane there that you'll be able to put a chat in where you can type the message. Don't see any questions coming through, Jason. It looks like, I mean, really, you did a great presentation. You covered a lot of information, all the different supplement, advantages and the advantages of, going over all the additional benefits with your plans and why, it would be important to definitely talk about those with your clients. So I think you did a great job.
Well, I appreciate it. The other piece I'll just end it with, so we do have a lot of great product benefits or changes this year that are going to be positive improvements. And so, well, we're expecting kind of the growth again of 3-4 years ago. We also know that we could have the top plans out there and everywhere, but ultimately it comes down to the agents that are going to be selling it. And so just wanted to give a big thanks to you guys from Humana, because obviously it comes down to you guys spending tons of hours during AEP actually going through benefits and enrolling people into the plan. So just a big appreciation from the Humana side. So much appreciated, and thanks, guys.
All right, fantastic. Well, we'll go ahead and end everything. If you guys do come up with any questions, you can always go ahead and email to training@ahcpsales.com, and I can get those over to Jason if I don't have the answers. But I definitely appreciate your time today, Jason, for doing the presentation, and everybody who joined us.